So I'm just going to jump into my presentation for IDHS. I want to tell you to bring you greetings from Barb Payne, who is the acting Associate Director of the Office of Early Childhood in the Division of Family and Community Services at DHS. She was intending to be here. She had a family funeral today and asked if I could come and share the information, and I said, I'd be delighted to. I will also tell you that I need to leave. I have a commitment though back in Springfield at 6:15, and so if I'm not here when you get to questions about my presentation, it's not because I'm afraid of them. It's because I had to leave, and Joni or Andy will see that I get them, and we will get the answers back to you. Okay. The Department of Human Services is, our child care programs are funded and directed by the Federal Child Care and Development Block Grant, and it changed in 2014. There was a revision in 2014, and can I put this here?
Yes, sure can.
Can you hear? No, let me move it forward. There, can you hear me?
Yes.
Now, yeah, good. It was revised in 2014 and went into effect immediately. And so states have been working very hard to implement all of the changes. One of the changes that has been speaking of hot topics, has been a hot topic in Illinois the last few months is the health and safety and child development training. And so I'm going to talk primarily about that. And I'm going to see if I can get rid of this little box here. There we go. Our child care programs exist to serve low-income families through the Child Care and Development Fund, which is what we use to fund the Child Care Assistance Program. And the Illinois State Plan is for federal fiscal years 2016 to 2018. It's a 3-year period now. Was designed to meet all of these new federal requirements. One of the big changes is the requirement for states to have health and safety standards for every single child care provider who receives CCDF money. This means, in Illinois, this means all of our license-exempt home providers, our license-exempt child care centers, as well as our license programs. Well, our licensing standards pretty well take care of our license programs, but we have 20,000 or more license-exempt providers that we have to develop standards for. And they also require that that the providers complete training on these topics. The states, the requirements are for both licensed and license-exempt providers. States are allowed to exempt relative providers from these requirements. However, IDHS has not done this, and that's because the department's goal is that all children in all settings receive quality child care. Secretary Demas is adamant about having this consistent levels of quality across all settings. We have some fascinating discussions about what that might look like in a license-exempt facility, but you know, if you think about a license-exempt provider who might be a grandma or an aunt, what we know about them is that they want to do the best job they can. Their ideas in their heads about quality are different than ours, but if we can help them learn about health and safety and some quality activities, that will increase that child's ability to succeed in kindergarten. So collectively, these changes impact a large number of providers, professionals in our field in Illinois. For example, the rules apply to nearly 11,000 licensed center and home-based programs in Illinois. From the registry, we know that around 45,000 individuals working in licensed child care centers or licensed child care homes are working in licensed child care centers or family child care homes. And we also have, as I've already mentioned, a significant population of licensed exempt providers. I decided kind of at the last minute that, because I will be talking a little bit later about the health and safety topics, that I might share them with you, and I think they're probably pretty small, but we can get, this is directly from the Child Care and Development Fund final rule. And so it's prevention and control of infectious diseases, prevention of sudden infant death syndrome, administration of medication, prevention of and response to emergencies due to food or allergic reactions. They talk about building and physical premises safety in a much different way than we often do when we're in classes, talking about making sure that our learning environments are safe. Prevention of shaken baby syndrome, which they added on September 30th, 2016. They added abusive head trauma and child maltreatment to that topic. Emergency preparedness and response planning. Handling and storage of hazardous materials. Precautions in transporting children. First aid and CPR. And the other thing they added at the end of September was recognition and reporting of child abuse and neglect. So when I talk, those topics are fairly well defined as far as we're concerned. We've asked about school-age providers and if they need to take the infant toddler ones, and yes, they do. It's the federal government. I'll probably talk about them more than our state government right now, but all of these directives are coming from the federal government. And Illinois, really, if we want to keep receiving our child care money, we need to comply with them. So the good news is, we do have some good news. We know that it's a big ask, but we've set up some infrastructure. On the Department of Human Services website, there is a link that takes you directly, this link will take you directly to the page about the health and safety training. So you don't have to weed through all the other information about the child care program. We have also done and revised already a frequently asked questions document that this is the direct link for. And we're constantly adding to it. Also, the last link on this particular slide is the link to the Gateways website, which also takes you directly to the page where Gateways is putting information about the health and safety training. These links will give you the most current information. Required by September 30th, 2017, registry membership, the first 4 modules in the level 1 training, mandated reporter training, CPR first aid certification, and if you're a director, what is CCAP? Required by September 30th, 2018 are the child development modules in the level 1 training. And those need to be completed by September 30th, 2018. We have seen since March 1st, 1,350 ECE level 1 credentials awarded. The other thing that's significant about that is that one of the things that we've seen is the week of April 9th, over 5,000 modules were completed just that 1 week for the ECE level 1 training. We have determined that other credentials, if you have them, they meet this requirement, and the ECE credentials levels 3 through 6, infant toddler, The infant toddler 3 through 5, the Illinois Director Credential 1 through 3, and the Family Child Care Credential 2 through 6. Anything that I haven't mentioned is either not directly related to care of children, or doesn't meet all of the 11 topics that are required. We consider everyone in this room a key partner in this work. 80% of the higher ed institutions in Illinois that have early childhood programs are entitled to award Gateways credentials. That's very important to us. To become entitled, you must have specific health, safety, and child development benchmarks or competencies within your coursework. And we know that this has been a change in the last couple of years, and that you're all working through it. The students who have completed the coursework and attained the credentials may have already met the health and safety training requirements. And again, this is the link that goes to the Gateways website. Oops. Registry membership is maybe the most important thing to do by September 30th, because that is how we're going to track the information on 30 to 40,000 different child care providers as far as their training is concerned. And the information, the data that we'll be able to glean in a year is amazing. 1 minute is amazing. And so you need to stay tuned. The next forum, I understand, will include license exempt workforce data. And I added very quickly, I forgot to add, this email address we set up specifically for questions about the reauthorization and the health and safety training. And right now, I'm the person who's responding to the emails. If you haven't received a response, I'm really pretty well current. We have received questions about some things where the policies aren't quite finalized yet, and so we need to wait a little bit on some of those. But that's the email that you can get some answers at, or you can send providers to. Also send providers. Yep.